ever felt sad? I bet you did. We all feel that. Because sadness is a normal reaction to life's ups and downs. Life has setbacks and disappointments. And we always react to that by being sad. Like, there's ups and there's downs. And our moods follow that ups and downs. A lot of people use the word, I am depressed. And when they use it, they usually mean that they're sad. That's what they mean by it. But, in fact, depression is a whole different thing. Depression is an illness. It's called clinical depression. It's an illness that affects your mind, your body, and your thoughts, and your mood. It affects the way you eat, the way you sleep. It affects everything. It is, in fact, an illness. And it is an illness serious enough that you can't just wish it away. You can't tell someone, pull yourself through. Get out of that. Because it's not going to happen like that. This is not what happens. This is not what depression is about. It's an illness that can't be helped. And we have to understand that it can't be helped. You can't ask people not to be depressed. They are going to be. It's something that lasts. Sadness is a feeling that you get when something you don't like happens. And then you feel sad for a while, and then you move on, and life goes on, and you forget about it. But in depression, it goes on for weeks, months, and even sometimes years of being depressed. There are a lot of people who do not understand that about depression. So, why would I be depressed? Why would someone be depressed and another person won't? It's a logical question. But actually, experts do not know the reason. They don't know why a person would be depressed. But what they realize is that it has a lot of reasons. Like, it has biological and psychological and social reasons. And those reasons make you more vulnerable to depression. It's different from one person to another. And they are called risks. That things that if it happens to you, that person might be depressed. One of them is actually having a history of depression in the family. If some member of the family has been through depression, then that's higher risk of you getting a depression. It can be about having to go through a childhood trauma or abuse. It can be higher the level of depression. Going through stressful events, having a very bad job or being unemployed, having financial problems, feeling lonely, having lack of social support, having a drug or an alcohol use or abuse, like being a drug addict or an alcoholic. Having a chronic pain that won't go away, a certain disease that just a case who someone has having for a very long time. All of this risk just higher our level of depression vulnerability. And we have to understand that reason, because when we understand the reason, sometimes if it's a mild or medium depression, if you understand the reason and you eliminate it, you can get a state of depression. Okay, that sounds serious enough. So I guess most of you are thinking, okay, how would I know if I have depression or someone I know has depression? Well, actually, that's something that's not for you to tell. It's for doctors. But don't worry, I'm not going to let you hang. There are actually signs and symptoms that if you have them, or if someone you know have a lot of them, then they probably have depression. And depression is, by the way, it's like any illness, it has a medication. When you take antidepressants, they go to the doctor, take antidepressants. Most people get through it and they're very fine. What are the signs and symptoms of depression? First off, it's feeling of helplessness and hopelessness. feeling of being stuck. I cannot be helped. Nobody can help me and I can't help myself. It's actually a radical change of weight, whether it's higher weight or lower weight, because depression has this thing where with some people they eat a lot and some people don't eat at all. Same thing with sleep. Some people actually, when they're suffering from depression, they sleep a lot. Some people, they don't get any sleep. It's anger. A lot of people, when they're depressed, they're very angry. They're very angry, especially guys. Sometimes they're not even depressed and sad, they're just angry and they snap at anyone very quickly. Lots of energy. A lot of people suffering from depression actually will be sitting around, don't feel like doing anything. And if you ask them, tell you, I don't have the energy to do that. Self-loathing is a very big thing. I feel like I hate myself. Someone who has depression is someone who hates themselves. They see themselves as worthless and as guilty and as very commonly bad people. Also, they are very, very reckless. They have this issue of not caring. I'm driving. They can drive very fast and not care if the car gets hit or anything. They can do a lot of sports, a lot of the dangerous sports. They have concentration problems. So anyway, if you know someone who has depression, your role is to convince them to go to a doctor to seek professional help. Listen to them, talk to them, be with them, and if you hear anything about suicide, don't take it lightly. I hope that this has helped you into helping people, Thank you very much.